Hi there, thank you for tuning in today. I'm Marcy Schoenborn of ShowFit, and today we have a really sensitive topic. And please, if I say something the wrong way, I don't mean offense to anyone. I've been overweight, and I've had people accuse me of saying that I don't like fat people. And when they say that, I know they know nothing about me, because you'll hear me say, we aren't fat, we have fat. And so I don't look at anybody and think they are fat. I also don't look at somebody that isn't coming to me for help and assess their body. So it's not, I want to get across that it's not like that, because I know this is sensitive. But we're going to talk about the high cost of obesity, who profits and who pays. And so today I want to talk about something that affects millions of people, billions of dollars, and the very core of public health, and that is obesity. So let's be clear from the start, this is not about shame or blame. This is about truth, health, and the very real consequences of a system that profits from keeping people sick, while individuals pay the price with their money, their dignity, and their lives. And friends, obesity has been glorified in the name of profit for food and for the food companies and for big pharma. And something that I hear all the time is, I'm very healthy, I'm just overweight. And unfortunately, I hate to tell you, if you are carrying 20 pounds or more extra, then you have dysbiosis going on. And that means you're not healthy. That means something's gonna break, okay? So obesity is not harmless. It is not just about appearance or body size. It is a serious medical condition that increases the risk for nearly every major chronic disease. According to the Centers for Disease Control and Prevention, CDC, obesity raises your risk of type 2 diabetes. Over 80% of people with type 2 diabetes are overweight or obese. Excess fat, especially visceral fat, interferes with insulin function. Heart disease, obesity increases cholesterol, raises blood pressure, and causes inflammation, all of which contribute to atherosclerosis and heart attacks. Stroke. The same factors that drive heart disease make strokes more likely. Certain cancers, including breast, colon, kidney, and endometrial cancer. Excess fat can produce estrogen and other hormones that produce tumor growth. Sleep apnea. Fat deposits in the neck and chest restrict airflow, interrupting sleep and straining the heart. Joint damage. Every extra pound adds pressure to knees, hips, and spine, accelerating arthritis and chronic pain. And if I remember the numbers right, it is 4 times. So say you throw out just 100 as an easy number to duplicate. If you weigh 100 pounds, when you step, your knees are receiving 400 pounds. So, and our body can take that. Our body was built to take a healthy weight. And I'm not saying 100 is a healthy weight. Please don't misunderstand, don't misinterpret. I threw that out as an easy number to duplicate. But when we weigh 300 pounds, our knees weren't made to handle 1,200 pounds. That makes a little more sense, doesn't it? So, and this is not speculation, this is settled science. The World Health Organization and virtually every major medical body recognizes obesity as a major driver of disease, disability, and early death. So let's not forget mental health. And actually, let's even go back to early death. I was talking to colleagues about this a couple years ago, and how we don't see obese people in their 80s. And there's a reason for that. They don't live that long. So let's not forget mental health. Obesity is linked to depression, anxiety, and social isolation. It can affect confidence, job prospects, and relationships. Not because people should feel this way, but because we live in a culture that simultaneously stigmatizes obesity and creates it through addictive food environments. And I certainly don't look at people and have an opinion that way. And I've been accused of it. And that's why I like to make it very clear. So just want to remind you of that again. And a joke with me always when I had 60 extra pounds was, well, it's paid for. And, you know, I've said to friends that are like, well, I'm bigger. I'm like, well, more of you to love. I mean, it's not, we just need to be gentle and kind about it, but it is not healthy. It really is not. So who profits from obesity? Here's the darker side. Obesity is hugely profitable, just not for you. The food industry, highly processed foods loaded with sugar, fat, and salt are engineered to hijack your brain's reward system. They're cheap to produce, shelf-stable, and addictive by design. Billions are spent marketing them, especially to children and low-income communities. The pharmaceutical industry, obesity drives demand for lifelong medications. Blood pressure pills, insulin, cholesterol drugs, antidepressants, and now GLP-1 weight loss injections. While some of these medications save lives at the time, make no mistake, they also generate enormous profits, and food can fix what the medications are doing. I'm never telling anyone to go off a medication, but when my clients start eating with me and start dropping weight and healing their cells, healing their body, then they go in for their routine checkup and their routine blood work, their doctor takes them off and lowers medication. I don't do that, their doctor does. That is what happens when you eat to heal. And doctors now are in the loop of pushing keto. And why is that? So here's what's going to happen with the whole keto world. And there's lots and lots more doctors jumping on board. My gosh, I saw the nonsense of a doctor saying that she tells her clients to eat a stick of butter in a day. And that is an accident waiting to happen, especially if you are on a tipping point of a heart attack or stroke. That is the dumbest thing I've ever heard a doctor claim. But here's why they're doing it. They can help you lose weight with keto, makes them look really good. And then when you still have or you develop kidney disease, non-alcoholic fatty liver disease, your A1C actually at lower for a bit and then get higher because the pancreas can't handle all of that food, that the food in the keto and the carnivore diet. Pancreas cannot handle that long term. Then you know what they tell you? It's your heredity or you're getting older. So they're off the hook. And friends, weight loss is not about buying a smaller casket. Shame on these doctors. It's gonna come out. It is gonna come out in time. Whether it's in 2 years, 5 years, or 10 years, it is gonna come out that keto is bad, just like it came out that Atkins was bad. All of these things have never had long-term testing that was successful. And by long-term, I mean 10 years. 10 years of following thousands of people that are having success with a ketogenic diet. And when I say success, I mean overall health. Okay, I'm a health coach. I know some people, oh, this is my weight loss coach. No, I am a health coach. And if it's not healthy, I'm not teaching it. So there's more financial incentive in treating disease than preventing it. There's financial incentive to doctors and to big pharma, of course, wins. So the media and cultural glorification. In recent years, there has been a shift toward body positivity that sometimes crosses the line into normalizing or glorifying obesity. And I am all for you should love yourself. You can love yourself and be overweight, be obese. That because you're not fat, you have fat. So stop owning it, remove it, love the self, and then work on your health. Love yourself enough to work on your health. And I hope that makes sense. So compassion and self-acceptance are essential, but we must not confuse that with denying the real, measurable dangers of excess body fat. Telling people you're healthy at any size without evidence is not empowerment, it's betrayal. It's a lie, it's a scam, it's betrayal. and it's not fair. So who pays the price? You do. Not just in health, but in healthcare costs. The average person with obesity spends thousands more per year on medical expenses. Lost income due to fatigue, joint pain, or disability. I don't know how many women I have made friends with in social media over the last 10 years in my age group, and I'm 60, so 50s, that at 50 years old were already disabled from foodborne diseases. But then I always hear, well, it can't be my diet. Can't be what I eat. Yes, I promise you it's what you eat. Promise you. And I can help you change that. So reduce quality of life from limitations on movement, travel, sleep, and social engagement. I had a huge reduced quality of life at 49. When I was 60 pounds heavier, I had type 2 diabetes, I had high cholesterol, I had IBS. That contributed to my poor quality of life because I lived an hour into the mountains, didn't even always know if I could make a drive to get to town to go to the bathroom. So couldn't always go to town. And never felt good. I couldn't even plan the next day because I didn't know how I was going to feel the next day. And now at 60, I feel great all the time. And I go for runs and I go for hikes. I used to live in a beautiful mountain town and I couldn't hike because my joints hurt so bad 11 years ago. So age wasn't the problem. Shorter lifespan. Obesity can reduce life expectancy by up to 8 to 10 years in severe cases. So and yet we blame the individual, not the system. We medicate symptoms instead of fixing root causes. And it is not your fault because you've been lied to. And here's something else that I also hear a lot is, well, I'm waiting for my doctor to figure out what's wrong with me. I promise you, in the months that it will take your doctor to figure out what's wrong with you, you could get on a healing path and start lowering inflammation, healing the gut, lowering inflammation, feeling better, and in 6 months, 12 months, 18 months, you're going to be a brand new person. Or you're going to wait, what is it? What is the saying going around? It takes 3 years and 5 doctors to diagnose an autoimmune disease. It can be prevented and it can be reversed when you catch it at the point when they don't even know what you have yet. And sometimes they can still even be put in remission or improved. I have clients with rheumatoid arthritis that have come off medication. Clients with PCOS that have achieved pregnancy and are having normal cycles. All kinds of different things, and it's just food. All I do, my job, I show you how to eat to heal the body. The food does the work, you do the work. The doctor doesn't have a choice because you've taken the need for them away from them, and they don't like that. I've had doctors get nasty with people. I have doctors thrilled for people, so it's across the board. You know, I don't dislike doctors, but there's a lot of nonsense going on in the medical world. So what needs to change? We need to stop calling junk food food. If it harms the body, it should be regulated like tobacco. We need better education. That's what I do. I give my clients an extensive education. I teach 186 hours a year. Each one of those hours is a different class. That's an extensive education. My clients can make an educated decision. My clients learn more about nutrition than most nutritionists and dietitians. So it really should start in school. What I teach should be taught in school, but we know it's not going to be. But we need education about real nutrition focused on whole plant foods, not calories and gimmicks. And whole foods, I'm not just saying plant food. So again, here she's vegan. No, and I have clients that are vegan. You can eat vegan and be unhealthy, or you can eat vegan and be healthy. I've had many what I call potato chip vegans come to me and they turn their health around because they stay vegan by their choice, but they stop eating the junk because potatoes are vegetables, so they thought they were okay. And so potato chips must be okay because they're potatoes, and then we're told this. And then there's all this beautiful packaging that this little weight loss bag of chips or these, different types of crackers that are supposed to be healthy, all kinds of lies, nonsense, and beautiful packaging that tricks the brain. And it's all by design. So meat or plants, but it just needs to be quality, and you need to know how to use it. So we need to push back on the idea that obesity is okay if you feel okay. Silent diseases don't wait until you feel bad to take hold. And that's why you'll hear me say every day we jump off a cliff. Every morning we wake up, and I equate waking up, being blessed to wake up, we jumped off a cliff. And if we are fueling our body well every day, we hang glide down. We have a great day. And we run around and we come back up, sleep, and do it again the next day. If we're not eating well, we still jump off a cliff every morning. If we're blessed to wake up, one day we're going to hit bottom because we didn't eat well. So food is that big of a difference. So we need to stop feeding disease and start feeding health. And if you've got a diagnosis and you are not changing your nutrition, you're feeding the disease. You're continuing to choose to eat what made you sick. So the great news, the human body is incredibly resilient. With the right support, nutritionally, emotionally, and socially, many of the effects of obesity are reversible. I see it every week with my clients, hundreds of clients now. Even 5 to 10% weight loss can significantly lower your risk of disease. Whole food, plant-based diets, physical activity, and lifestyle changes have been shown to reverse diabetes, lower cholesterol, reduce inflammation, and improve mental clarity. And those are things we see happen to clients in the first month. We see mental clarity better in the first week. I have clients, actually a client today, I got an email, they're in day 5. The husband is down 8 pounds and didn't have to use his insulin all week because he was so balanced all week. That's how quickly food can make a difference. So it's not about looking a certain way. Aesthetics are the bonus. It's about functioning optimally, living fully, and breaking free from systems designed to keep you sick. So obesity is not just a personal issue, it's a public health crisis, a social justice issue, and a business model for industries that profit when you suffer. But you're not powerless. You can reject the lies. You can choose foods that nourish rather than numb, but you need to know the truth. There are so many lies out there. Keto is not the truth. Carnivore is not the truth. That's going to come back to bite a lot of people painfully. I teach the truth, and I teach it in layman terms, teach you what's going on inside your body. I give you menus, I give you recipes, I give you shopping lists. I make it so simple that you can't mess up unless you choose to. And then the nice thing is, if you're in my handheld program, if you mess up, I help you create emotional tools to figure out why that happened. I don't judge. I don't say, why'd you do that? I say, okay, let's unpack what happened that day. So it's a very kind, gentle system that I run. So you can reclaim your health, not for some ideal image, but for strength, freedom, and longevity. Run around with your grandkids. You know, friends, we work our whole life. We work hard. We raise our kids. We take care of our family. And we retire to go to medical appointments. It doesn't have to be that way. I'm proof, and so are my clients. So if anything I said resonated with you, subscribe, direct message me, comment below. I would love to talk to you about changing your life, because it can be done. So be blessed. I'm so glad you were here. If you have a friend that you think would like to hear this, please share it with them. Have a great day.